Isebe Lezempilo laseRhawutini lithi likhawulezisa utshintsho lokuphucula ukusilela kweenkqubo zotyando okuchaphazela izigulana ezingaphezu kwamashumi amathathu amawaka kulo lonke iphondo. Iingxelo zityhila ukuba ukulibaziseka kubangelwa kakhulu ziimeko zakudala, uxinzelelo lweziseko zophuhliso, ukunqongophala kwabasebenzi kunye nokuphazamiseka kweenkqubo ezingundoqo, kubandakanya nemingeni yokunikezelwa kwamanzi echaphazele izibhedlele ezininzi kunyaka ophelileyo. Isebe lithi amanyathelo amatsha anjengeenkqubo zokuqokelela iinkcukacha zezigulana ngobuchwepheshe banamhlanje kunye nokwandiswa kweeyure zokusebenza kumaziko sele zivelisa iziqhamo ezihle.
The Gauteng Department of Health is currently intensifying the targeted system reforms to reduce the surgical waiting times and improve on equitable access to care across our public hospitals. We are, as a department, currently addressing a backlog of just plus minus 30,000 patients that are waiting for various procedures at different levels of our hospitals. The majority of these procedures are legacy cases that have accumulated over time due to increase in referrals, some due to infrastructure and equipment constraints. Also, not forgetting that there has some issues with workforce limitations, especially on surgical skills, and sometimes as well we have in recent years have had service disruptions that we have experienced. So as a department, in response to these surgical waiting times and backlogs, we have introduced some measures that include a treatment time guarantee that we've digitalized the platform in a form of a dashboard. This enables us as a department to have a real-time tracking of our patients across our surgical pathways. This has resulted in improved visibility of the waiting list and has assisted us in strengthening coordination between facilities, and we are able now to support these institutions and be more responsive, and it assists us in clinical decision making.